Sure. This is, it's such an interesting program. It's a phase 1 study looking at safety and tolerability as the primary outcome, but also pharmacodynamics, pharmacokinetics, and downstream exploratory biomarkers of disease. The population is young onset Alzheimer's disease. So it's not a phase 1 study in healthy controls. It's a phase 1 study in people who have a chance to benefit from knocking down or shutting off production of amyloid. And subjects had to have the onset of their disease under age 65. So we're dealing with a little bit younger population, not specifically looking for people with autosomal dominant Alzheimer's disease, but more young onset, thinking less comorbidity disease, more likely due to overproduction of amyloid than other comorbidities or other reasons. So that's the population. All of them confirmed to have amyloid through CSF or PET imaging, and they are at the MCI or mild dementia stage. So early AD in a young onset population. And it is a phase 1 study in 2 parts. Part A is a single ascending dose study. So what happens after you give one intrathecal dose and follow these patients for at least 6 months or out to 12 months, depending on washout. So the part B, which we haven't reported on yet, is a multi-dose study where each individual will have more than 1 dose of drug. So what we presented at AAIC just was the last week, time flies by, was a cohort of patients now with a cutoff of, I think April was the date, 36 patients now with young onset Alzheimer's disease. Previously at CTAD and AAIC in 2023, we had reported smaller numbers and shorter durations of follow-up, but now we have 36 patients and we have follow-up out to 1 year. For the pharmacodynamic effects, of course, safety, full duration, and for the biomarkers of disease, A beta 40 and 42, we have results out to 6 months. So very exciting, and I can share the results. I mean, top line safety, since this is a phase 1 safety study, it is incredibly safe to deliver an RNA silencing a drug targeting amyloid precursor protein. And how can that be? I mean, what does APP do? We know in neurodevelopment, it's pretty important, amyloid precursor protein in neurogenesis and synaptic formation and networking. So does it really do nothing in the adult brain? That's what you find out in a phase 1 study. Right now, we are seeing mostly mild to moderate adverse events related to lumbar puncture. And 3 patients were said to have adverse events related to the drug itself, but the same adverse events were also attributed by the investigator to the lumbar puncture at the same time and consisted of headache, neck pain, nausea. So sounds more like the lumbar puncture. There was 1 patient who had very transient on 1 blood test, mild lymphopenia, which resolved by the next blood test and no clinical symptoms. So again, that probably will disappear with a larger sample of patients and longer duration of safety monitoring. So the bottom line is we're seeing the kinds of side effects you would see in patients who have LPs. And you have to remember that in this phase 1 study, individuals are having 9 LPs within the first 6 months. So they have intrathecal dosing at day 0, they come back at day 2, they have an LP, they come back at day 15, and then month 1, 2, 3, 4, 5, 6. So 9 LPs, and it's really a testament to the fact that people are eager to have access to a therapeutic, even if it's in the investigational stage. So really, when you average the number of post-LP adverse events over the number of LPs that people are having, there's nothing extraordinary about it. So safe drug, and when we look at usual blood work and cardiograms and all the other kinds of safety monitoring, we're not seeing any signal that there's any concern. So if we move from the safety then, which we're pretty excited about, particularly when you think about anti-amyloid monoclonal antibodies and other classes of drug and the kinds of safety concerns that can occur. Here we're delivering something directly into the central nervous system and not having side effects that we can discern. So if we go to the pharmacodynamic markers, this is very exciting. Now we have results out to 1 year, and we see very robust, dramatic, and enduring knockdown of soluble APP alpha and beta. So these are the fragments that are sort of first off the chain when you catalytically, dispose of amyloid precursor protein from messenger RNA. So we're seeing in the order of about almost 75% knockdown maximum at 1 month. So that's early for amyloid soluble APP beta. So already by 1 month, you're seeing a real reduction, and it endures out to 1 year. Starts creeping back up, but there's still significant reduction in soluble APP beta and alpha out to 1 year. So that tells us there's target engagement, we're acting on the right protein, we're reducing production. We're not getting complete knockout, and this is a single ascending dose phase of the study. So there are more doses being tested that we haven't disclosed, and how much knockdown is the right amount is still to be determined. But we know that in a dose-dependent manner, we get this enduring and very substantial knockdown. Now, if we go to the more usual disease markers for Alzheimer's, A beta 40 and 42, we are also now seeing that we can impact those substantially. So we have data out to 6 months, and at month 1 for A beta 40, we're seeing about 65%, 66% reduction from baseline. And for A beta 42, it's about 50% at month 1. And then we have an enduring effect out to 6 months. So very, very hopeful data. Of course, the study's ongoing and more doses are being tested. And we haven't even begun to report on multi-dosing in Part B. But you can see that the profile emerging actually rather rapidly, that we have very accurate target engagement. We don't seem to have any off-target effects. We're getting the protein reduction that we're aiming for. And because of the enduring effect, there is the possibility that maybe this is a drug you could dose twice a year or something like that. Again, that's me talking. Alnylam's not putting that statement forward, but when you look at the durability of the response, that seems reasonable.